This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Direct primary care is an innovative alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
DPC is the arena that allows me to be a physician, a business person, and a father. Hi, my name is Michael Lovelace, and I own Derby City Direct Primary Care in Louisville, Kentucky. And this is my DPC story.
Dr. Michael Lovelace grew up in a small town in upstate New York along the Hudson River and ended up trading his snow shovel for sunshine after high school. He headed to Loyola University in New Orleans for his undergraduate degree in finance, and then later on to Arizona State University in Phoenix for his MBA. He has worked as a financial analyst for a Fortune 500 company, project manager for a nonprofit institute, and ran a family business, Plant Nursery, with 45 employees. While working at a cancer research institute, he made the decision to change careers and go back to school to become a physician. After graduating from the University of Louisville School of Medicine, he completed his training in family medicine in Columbia, South Carolina. He chose the specialty of family medicine because of the wide spectrum of illnesses that he can treat. As family medicine physicians are trained to treat newborns, pediatrics, women's health, adult chronic disease, and geriatrics. During his training, he studied different practice models and chose to open a direct primary care practice because he believes that it provides the best opportunity to truly connect with patients. As a former business owner, he understands that providing quality customer service requires time. Another huge positive of being a DPC practice is that he can save patients money on medications and labs. When he's away from the office, he enjoys playing golf, running, and gardening. He also loves spending time with his wife, Rebecca, their 2 young children, John Michael and Allie Claire, and their rescue dog, Rue. Welcome to the podcast, Dr. Lovelace.
Thank you. Thank you for having me.
This is such a treat. We're recording probably end of summerish here, and we've been trying to get you on the pod for quite some months since I met you at Claude Ryan and Aliyah Gupta's mastermind last year. So I'm super excited to have this conversation. I just want to kick it off with the fact that your journey into med school was a little bit different than somebody who's going from high school to college to med school. And so tell us about what was life like before you even started med school.
Before med school. All right. Well, that's a story in itself. So kind of briefly, I grew up in upstate New York, bounced around, went to a ton of different public schools. And when I finished high school, I know why I went to New Orleans for Mardi Gras. So this is strictly on nothing academic about this. And had a great time, shocking. 18 years old in New Orleans during Mardi Gras, and Loyola University was there. And I applied to go there, and I got accepted and went to college down in New Orleans, got a finance degree. And when I graduated, moved out to Phoenix, Arizona, and started working in finance. I did that for about 15 years total. Shortly after moving to Phoenix, I went to Arizona State University, and got my MBA in the evenings. And throughout that 15 years, I was a financial analyst, a project manager. I worked for some Fortune 500 companies, Lockheed Martin, Xerox. And then I also worked for a small family business in central Louisiana, growing plants in a nursery. So it was like a 200-acre nursery. And then in my mid-30s, truth be told, in my mid-30s, I got divorced. And I literally had like a reset moment where I had flexibility to go wherever I wanted. And medicine was in the back of my mind for many years. And I think like a lot of non-traditional students, we had plenty of logical reasons not to go to med school between time and cost and not sure if you're going to get in. And so I actually went and worked for a genetic research institute in Phoenix as a project manager to try and bridge science and business. And I did that for about 2 years and realized it was interesting, but I realized I was more interested in the clinical work that they were doing as opposed to the business stuff. And so the University of Louisville has a post-bac program for folks who don't have a background in science. And so I applied to that program. I got into it. And that's basically how I got into med school, was through a post-bac program. It was definitely a long road. I quit my job and started at Bio 101, Chem 101, Physics 101, and did pre-med for 2.5 years. And so in my class, little fun fact, I was the oldest person in my class. So my first year of med school, I turned 40 in the fall.
And here you are. I love it. Like, I am cheering over here on this side of the mic because, one, I am also a post-bac grad between UC Davis and I did a Creighton post-bac. So awesome. I definitely want to ask you more about that in a second. But also, like, my lecture buddy was Dr. Stephen Barbie, and he was also a non-traditional student. He was, I think, there were 2 people who were non-traditional who had careers prior to medical school, I believe. And he was one of them. And we were lecture buddies. Every single day we would be like, oh man, it's that dude. Or like, oh yes, it's roller coaster dude. Like, I enjoyed talking to him so much because he had so much life experience. I believe he worked for NASA. If I'm mistaken, I apologize, Dr. Barbie, but he's an internal medicine doctor. And it's so funny. And I think I've mentioned this on the podcast before, but like when we were on the Creighton selection committee for incoming medical students, number 10 was, what was your MCAT score? Number 1 was like, would you want this person to be your doctor? Like that type of question, like the life experience that someone has coming into medical school. Like, I remember, I think Dr. Siri Carney she had done phlebotomy before. There were people who had, not necessarily careers before, but definitely different experiences coming in, like camp counselors and accountants and all this stuff. So I just love that you brought such a rich, history and background already when you started learning about how to take care of the human being, because all of what you've learned, I'm sure, has influenced you in terms of not only your medicine, but also your business decisions.
Yeah, it has. One of the advantages of being older and going into, like I said, I practiced business for 15 years. So I was a patient. I didn't know anything about medicine. I wasn't involved in medicine. And so I got to experience primary care in the quote traditional system, and the difficulty getting in, the short appointments, the surprise bills. I got to do all that. So when I started designing my direct primary care practice, I have those thoughts in mind, like how would the patient experience this, and how would I want to experience it as a patient? So there's definitely an advantage of being an older med student.
Well, it was the same at Creighton. For me, I wasn't necessarily non-traditional in terms of I didn't have a full career before. I worked for like odd jobs between medical school and undergrad. For me, taking a test is the hardest thing ever in my life. Like, sometimes having, being a mom of young kids is even easier than taking a standardized test for my brain and my ability to sit down and in a room of, other people typing on the computer for 7 hours. Like, oh my God, I'm sure other people are having flashbacks to that too. But Creighton, even though I wasn't a quote unquote non-traditional student in the sense that I didn't have a career before, I absolutely felt so much more confidence getting into a program where, as long as we maintained a certain GPA and a certain MCAT score, then we would be guaranteed admission. The way that it worked at Creighton at the time, I don't know if it's still the same, was that
every year you matriculated with your class, you earned basically your post-bac tuition back. So every year you would earn a quarter back of your tuition. So I basically was able to go to post-bac for free because I matriculated every year with my class at Creighton. So I just love that. And I think about people like Dr. Cindy Daffy. She opened DPC right out of residency, but people who are like yourself, myself, Dr. Daffy, who are like, and we're going to go to med school. We're going to do this. Like, how do we do this? I mean, even Dr. Jennifer Allen, like she had a very different way of getting there rather than like, I applied and I'm in. Like that's how most people get in, and that's awesome. But for the rest of us who didn't get in that way, this is why you're sharing your story. This is why it's important. So when you were thinking before that medicine was always in the back of your head, why was it in the back of your head?
I was always interested in the human body. I was interested in science. At that time, we're all obviously naive to how medicine really works when you're thinking about going into medicine. It was like, see a problem, solve a problem. Like, in the business world, I was a problem solver. That's what project managers do. And so you combine the science and the interest in the human body, and then the opportunity to solve problems that are just straight in front of you. And it sounds like an exciting career. Obviously, once you get into it, it's a little bit different. The actual, trying to help folks and insurance and working through the systems, then the problem solving becomes more challenging. But that's really what drew me into it initially. Yeah.
Awesome. And then at what point during your medical school journey did you decide that family medicine was going to be the career path for you?
I went into third year with a pretty open mind as far as what I was thinking of going into. What I kind of noticed for me and my personality was that when I was on a specialty, let's say we were on pulmonology, it was interesting, but there was also other components of their health that were factors that I was also interested in. And so it kind of reinforced that as a family medicine doctor, I wanted to be able to talk about any part of the body. And then at the end, it came down to internal medicine versus family medicine. And I picked family medicine more because it's more outpatient based as opposed to internal medicine was at the time.
Awesome. And your desire to find problems and solve them. There's a lot in family medicine. So good choice. Good choice there. Yeah. Now, when you had finished your residency, you went to residency outside of Louisville. You went to South Carolina, and then you went back to Louisville after residency. So when you were in South Carolina and you were doing your residency, had you always planned to move back to Louisville, or did you think about staying in South Carolina?
So when we were, my wife, going into medical school, I was then dating my now wife. And so I was married in med school. And so when we were looking at residency options, we were both interested in living in the Carolinas. So that was part of the interview trail that we went on. And so we liked Columbia. When we got there, it was hot. And it was just funny because I lived in New Orleans and Phoenix and in Louisiana. And my wife also lived in New Orleans, but we were both like, Columbia's hot. And we had such a good time in Louisville. The weather's, a little more temperate and it's a fun town and it's a great place to raise kids that while, basically halfway through residency, we both knew that we wanted to go back to Louisville. And during med school, we had established friends here too. So we had something to go back to. So we were pretty excited to go back to Louisville.
Awesome. I'm laughing because you said, I was in Phoenix. I'm like, it wasn't, 2023 when you lived in Phoenix, because now the weather is very, very hot. Now, when you were, you chose family medicine, you're in residency, and you had been a patient also, like you mentioned yourself, and you had an idea of what the ideal family medicine doctor would be able to do, or what, the ideal family medicine clinic would be for you. Did you seek employment after residency in Louisville, or did you start planning your DPC while in residency?
I started planning my DPC in residency. It was probably early in the second year. I did, just to be thorough, I did look into employment opportunities in Louisville, because I think when you're making a decision like, starting your own practice, you want to know what you're giving up. And also because until you can evaluate all the options, you really can't make the best choice for you. So I did explore working for, the traditional healthcare network here in Louisville. But I had convinced myself and my wife, we were both pretty sold on starting DPC straight out of residency.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
I love it. And when we talk about your experience as doing financial project management and being the person to look at all of the options financially, when you were looking at job options and you were, looking at all of the options in Louisville for being an employed physician, what were some of the things that, to this day stick out in your mind as to like, this was a red flag, or this was something that would not work with my future plans, or this is something that people should look out for if they're in that same boat, graduating residency or about to graduate residency and looking at employment positions?
Yeah, at that time, the funny thing, the biggest factor that came into play was, one, did I want to work for somebody? I was in the middle of residency, and as we can all say, residency isn't fun. And so it's like, oh, I could keep doing more of this, the 10, 12 patients every half day and stuff like that. So there was definitely that factor. But I was also looking at my age. And at that time, we had our son, and then our daughter was coming along. So we had two kids. And the thought process was, okay, let's say I'm going to graduate residency at like 46. Am I going to go work for a hospital network for 5 years and then making some money and then go back down, dropping my pay down to nothing and starting a business at 51 with 7 and 8 year old, kids under 10 years old? And talking with my wife, we both realized like right out of residency was the time to start for us, because we were used to resident salary, and it was like not a lot of things more motivating than having your back pushed up against the wall. It's like there's no paycheck coming in. It's you got to sell the practice, you got to start the practice, you got to work the practice. And so basically we were highly motivated to get it off the ground straight out of residency. So that was the thought process that I went through. Now, 3 years later, and being a finance guy and kind of knowing what it is to run a business, what I would say is it is not the worst idea to go take a hospital job straight out of residency. And here's why. Because one, let's say, for example, I was in Columbia, South Carolina, and yes, it was during the pandemic, but even if it wasn't, I can't do any on-the-ground marketing in Louisville until I'm here. I mean, sure, I could come up for a weekend, but you're not going to run around and say, I'll be your doctor in 6 months. So that puts you at a disadvantage when you're trying to start a business remotely, from out of town. Number two, you get a salary day one. They also help you with moving expenses. You get a sign-on bonus. Majority of us have student loans. You get loan repayment. Even if you only do it for 2 years, you probably get $50,000 from that. And then the next thing is, while you're practicing in that town, let's say while I'm practicing in Louisville for the hospital network, that's when you build your reputation. That's when your patients get to know you, their family members get to know you. Let's say after 2 years or 3 years, you've hopefully paid off some of your loans, you built up some nest egg and some savings. You now have a name, your name, that you can use to get your practice off the ground. When you go on the DPC Facebook page, a lot of the folks who were established physicians, they start day one 25, 50, 75, 100 patients. If you're, let's say you're, for easy math, if you're charging $100 a month, there's a big difference between having zero revenue and $2,500 or $10,000 a month revenue on day one. That increases the probability of you having a successful business tremendously, being able to start day one with $10,000 a month in revenue. So for me, it was the right decision to go straight from residency into my own DPC practice. But if you've got a lot of debt and you're not comfortable with it and you're not, backed up against the wall like I was per se, partially due to my age, it's not the worst idea to go make some money, save some money, build a reputation, and then be able to hit the ground running when you start your DPC.
Love it. Bring us back to second year residency when you're thinking like, oh my gosh, I could be doing more of this the rest of my life. How did you learn about DPC back then?
I learned a little bit about it during med school. And then I think I found some couple of podcasts. There's some like old podcasts. I think they're from like 2017 or stuff. But these were like the early folks in DPC who were talking about different components of starting a direct primary care practice. So yeah, during like first and second year, that's when I started researching it and really looking at the pieces on how to practice. Now for me, I knew the business side. So like I understood the revenue. I could figure out how much my cost generally was going to be. The hard part was figuring out the sales part, because in medicine, in direct primary care, you're selling your practice to your patient. You're convincing them to pay you when they think they already have healthcare through their health insurance. You're also convincing them to pay you today when they know they're not sick and they feel like they're not going to be sick, but you're convincing them to pay for the membership and the subscription for when they are sick, that you'll be available to them. And so that's definitely a skill that I still struggle with, but I definitely had to build when I started my practice and was going through the startup process.
And as you shared with us that for you, it was right to start out of residency into your own DPC, and you're back in Louisville. Before you opened, as you talk about, you already knew how to do the finances. What are some of the things that you did leading up to opening in terms of making sure that you were going to be, financially set in terms of having a backup plan, having enough money to fund the first 6 months or the first year of your practice? Mm-hmm. And what are some things that you would suggest people do, like learn how to do a P&L, those types of things?
Yeah, so it was interesting. I was thinking back about this. So I opened my practice August 1st, 2020. So it was pretty much, obviously right in the middle of COVID. So the things that I would say were the key things. So there is this thing called a financial runway. You kind of alluded to it, which is how many months of expenses do you have in cash today? And because basically, let's say your monthly expenses are $10,000 and you've got $30,000, basically, in 3 months, you are broke. Your business is shutting down. You got to get a paycheck, starting day 91. So you got to figure out, one, how can you minimize your expenses? So how can you take it from $10,000 to $5,000 per month? And two, how do you build that nest egg from $30,000 to $50,000 or $60,000 so that you can extend that financial runway? So what we did, just before COVID started, I was able to do some moonlighting. So we're able to save some there. And then my wife was working as well as I was doing residency. We didn't have a fancy house and we had same cars. I still got the same car I had then. So we didn't have car payments and stuff. So we were able to save money and build up cash nest egg. Now, I mentioned the COVID part and I forgot about this, but you used to get checks like every month or every 6 months. They'd be like, here's $1,000 per person. And we had 4 people. So we would get these lump sum checks from the government, and we got like the child care credits, like they doubled it 1 year. And so we had all this extra, just like everybody else in the economy, we had all this extra money that we were able to put aside to build out, to extend our financial runway. So we had, 6 to 7 months, let's say, of cash saved up. So that's how we were able to do it. And that is literally, the one takeaway from this is that is the most important thing. It is hard for non-business people to believe this, but you can have the best product. You can be a doctor. It's like Who doesn't need a doctor? Like, you can find a job in 48 hours, right? A bank will not lend you money if you do not have a successful business. They will not lend you money on potential. They will talk about it, but they won't give you the check. This is how crazy the banking business is, but you need to know how it is before you go into it. So my wife worked in the hotel business. She was laid off during COVID, and then I finished residency. So we didn't have any, quote, documented income on day one. Luckily, we had already bought our house, but back then, interest rates were really low. So I talked to him about, hey, we've got some money. Can we refinance this? We already own the home. And the banks were like, no, we can't because you have no verifiable income. And I'm like, but I'm a doctor. I could go get a job tomorrow, like I said. What ended up happening was 6 months after I started it, I got a W-2 job with a moonlighting gig, and I got 2 paychecks. And I called up the bank, and they were, and I'd already spoken to them, and they're like, okay, great, you've got 2 paychecks. We will now refinance your $500,000 home on 2 paychecks. And that's the way the banking world works, is they feel that the W-2 paycheck is guaranteed, and your business, regardless of how successful it is or how successful it's going to be, it is not really guaranteed until it's already happened. So a lot of times it's 2 years where you've been making good money. So the first 6 months where you're not making money, they don't count. Like, it's 2 years of steady money where they will acknowledge that as income. And so that can really put you in a tight spot when you're trying to like move to a new city and buy a house or finance a car or anything like that. So that goes back to, you have to have enough cash when you start your business day one to cover your fixed expenses for 6 months or 9 months or ideally a year, because you're really the only one that's going to help you. And once your credit card company finds out you don't have regular income, they're going to drop your credit limit. And so you will, day one, you'll be like, oh, I got $25,000 on my Chase card that I can use whenever I want. And then they find out you're not working, and all of a sudden you've got $2,500 in credit limit. And yeah, they actually, Chase did call me like shortly after we moved back up to Louisville, and they were like, we're a little concerned what's going on with your credit card. And we had just moved into a new house. So of course we were buying things, and it's like we were buying paint and all furniture and all this stuff. But they watch it closely. If they see that you're spending abnormal, they will either just cut your credit and ask questions later, or they'll reach out to you and say, what's going on? And that can be detrimental when you're trying to run your business and you're using your credit card as your backstop, because in reality, it's not a very solid backstop.
I'm so glad you're mentioning these realities about, especially leaving residency, and you're not necessarily making more than $50,000 a year as a resident, and then moving and doing all these things that you went through. Let me ask you there, when you talk about refinancing your home, are you talking about a line of credit because you said you owned your home, or did you refinance it in a different way, like using a mortgage to refinance your home?
Yeah, in our case, we just wanted to refinance it because I think we were taking it from like 4.5% down to like 2.5%. So we were just taking advantage of that. And so we weren't pulling out money for that purpose. We were just saving money.
And can you speak to good credit versus bad credit? Because I'm sure there's some people out there who are like, oh, I don't want any debt at all. I don't want any more debt to add to my student loans or whatever.
Yeah, that is a tricky question, but it's an important one. So yes, if you are somebody in the credit world, if you are somebody who's never bounced a check, you've never needed to take out a loan, you've never needed a credit card, you paid cash for everything. You bought your car, you paid cash. Let's say you've always rented or you lived at home. In the credit world, you don't exist. They have no history of somebody lending you money and then you being reliable to pay it back. I'm not saying you want to go out and take out loans unnecessarily, but when you can, so let's say you're a resident and you've got a steady paycheck, and let's say you've never had a credit card, you want to make sure you get a credit card. Even if you just charge your Netflix to it and then pay it off at the end of the month, one, that shows that you paid your debts on time, so that improves your credit score. Two, it also shows that you don't rely on your credit card to fund your life. So this is a tricky thing. They give you a credit card because they want you to spend money, but then they don't want you to spend too much, because if you do, you've almost maxed out your credit card and now they're worried that you can't really pay it off. So that's where they call it, it's like a percentage of usage of your credit. And so when you can, particularly like, let's say when you're a resident and you have a W-2 job, that's when you want to get your credit cards established. And that will establish your credit rating so that when you go to buy your home or when you need to borrow money, that credit score is going to help you. So to give you an example, 2 years into my practice, there was this building came up available for sale. And so I decided to buy it. I didn't have the money just to pay cash for it. So I needed a loan. Well, my business was successful. So that's good. That checks off one box and I was making money. That's great. Checks off the second box, but I had a good credit score. So those three things made them feel comfortable enough to loan me enough money to buy the building. If I didn't have a credit score, or if I had bad credit or a low credit score, they would say, yeah, you're making money and yes, your business is successful, but look at your history. You don't pay your bills. And we're not comfortable taking that risk. And then the opportunity for me to buy the building would have passed. Or they would say, we're going to penalize you for having bad credit. And instead of it being, let's say 5% interest rate, we're going to charge you 10. And nobody else wants to lend you money. So either you want the building or you're going to pay 10%. And that's when you get forced into really bad financial decisions. So so establishing credit is really an important part of moving into adulthood, basically.
I love that. Oh my gosh. Yeah. I remember very vividly at UC Davis in the quad, there was like, open a free credit or open a credit card today and get 3 free posters. And the amount of people that I saw just like getting all the posters and then having this, like go crazy with their credit card experience. It was like, oh my goodness, like don't do that. But, as you talk about, like, even if it's just a Netflix subscription, like literally that is, you pay it off at the end of the month. That is, like you're saying, super important to think about. One of the ways to build good credit. Yeah. And when you took out a loan to buy your building, did you go to some financial institution locally, or did you approach a national financial institution?
Yeah. So in med school, one of the local financial institutions sponsored a lot of our activities. So basically it's a good business plan. So they sponsor activities in med school, and then a certain chunk of folks stay in Louisville to go to residency because University of Louisville's got a lot of residency programs. And so those folks now are eligible to buy homes. And so they kind of feeds into, they use that bank for physician approved loans. So when I came, I knew the banker. When I came back to Louisville, I'm like, hey, we're coming back to Louisville. I need to open up a business account for the business. So I did set that up. And so all of my revenue went through that business account. And so when the building came up, I could point back to the bank account and go, here's the money that I'm making, or this is the money that I've got. I also had to provide financials, profit and loss statements, but, they could see the money that was sitting in the bank account, and they knew me personally because I knew him from med school. And so that was going back to, let's say, 2015. So this was coming up on like 8-10 years that I'd known the banker. So he was able to advocate for me to the committee, because there's always a committee that just makes the decisions on these loans when I applied for the business loan for the building. So that is, in a perfect world, if you can set up that type of relationship with a local banker, that can be helpful when you get into those sticky situations. And what I mean by sticky situations is let's be honest, I'm a doctor who opened up a practice a year and a half, and now I'm asking for, hundreds of thousands of dollars for a building. And what are the chances that my business fails? I mean, that's another reality about running a business, is there are many good businesses that fail for reasons that are the owner's responsibility and reasons that the owners don't control. And so the banks have to take those things into consideration. So having that relationship with the local banker, I think really helped work through the process when I was applying for the loan.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
And can you speak to longevity of the loan, a 10-year versus a 20-year versus a 30-year, and paying off a loan too early?
Yeah, so this was something I didn't know about because I'd never done a commercial loan before. So what I got was the way it worked, or at least the way it was proposed to me, is it's a 7-year ARM loan. So that means that the interest rate is fixed or will not change for the first 7 years. But the payment schedule is based on a 20-year loan. So basically, it's set up that if I made the same payments over 20 years, the loan would be paid off. So that's what that means. But after 7 years, the interest rate's going to adjust. So, I still got 5 more years, but let's say it were to change, adjust today, it would be significantly higher than what I got a year and a half ago or a year ago. So, but that's the way, or that's one way that commercial loans work. As far as paying it off too soon, I haven't run into that problem yet, but but in all truthfulness, I am paying down the debt. So that's one of the things. I'm like fiscally conservative. And when I can, again, keeping my financial cushion, keeping my financial runway long, if I now have excess funds, I can look at, okay, what debt do I pay off? And so right now I'm going to pay off the business building debt. And in part, and this is just my own personal decision, in part because that once I pay off that asset, that's an asset that can pass down to my wife and my kids in the event that I die, right? If you got the building and a huge mortgage, then basically once you die, they're just trying to sell the business, pay off the mortgage, and the asset really kind of dissolves. So that's part of my financial plan, is to pay off this asset so now it's available to go on to the next generation.
Love it. So you're in Louisville after residency, you're opening up your DPC in the middle of this amazing pandemic. How did you start getting people to join your practice? You talked about that, that this is something you're still working on, but how did you start, and what have you changed in terms of marketing and strategy to get the word out about your DPC?
Yeah, so it's kind of looking back, it's a funny story. So patient number one, who is still with me, but patient number one, I was down in Columbia. She called me up and she said, I heard from my daughter, who heard from a friend, that you're opening up this type of practice and this is what you're doing, and I want to be a member. And I was like, okay. And so I'm like, I'll open up in August. And she's like, that's fine. Here's my phone number. You call me when you're ready. And I was like, okay. And so I got to set up the EMR, and I sent it to her, and she signed right up. And I was like, well, this is going to be pretty easy. All people need, I just tell them I'm open, right? And that's not the case. It did not grow like that from that point on, but it was limited by COVID. You couldn't do group events. There wasn't a lot, it would be crazy to go door to door and talk to people and stuff. We tried a bunch of different marketing things. We did some mailers to businesses. We did mailers to homes. We signed up for one of those mailers where there's 10 different businesses on a postcard that goes to a zip code that really are cheap, but honestly, it just didn't work for my practice and stuff. I talked to a lot of people when I had the opportunity. Again, during COVID, you really didn't have a lot of opportunity to do that. I tried social media like Facebook postings. It's just not something that I'm not comfortable with it and not great at it. Basically, every time I post something, I get some comment about somebody talking. You post the flu shot's available, and the person says, by the way, that the flu shot causes the flu and blah, blah, blah. And I just don't want to have deal with that. And then generally speaking, it generated clicks, but not membership or traffic. At that point, again, go back to the financial runway, the cash cushion. I'm spending more than I'm bringing in because I got one patient. So I'm bringing in, $80 a month. So it's okay, what are we going to do to generate revenue? And so I had some people who knocked on my door, and they were like, are you a doctor? And I've got this rash, which, shingles, whatnot, can you take care of it? And I'm like, well, this is what I do membership wise and da da da. And they're like, well, I don't want a membership. But I'll pay you if you can take care of this right now. And so at that time I was charging $80 a month for membership. And I was like, you got to charge more. So I just pulled the number. I looked actually at the competition, and the urgent care visits were going for $125. And so I started doing some urgent care visits. Not many of them converted, but they brought in revenue. And so, it wasn't crazy. I might have done 5 to 10 a week. So, $500 to $1,000 a week, which is $4,000 a month compared to $80. And then through the DPC Facebook groups, I found out about the veteran disability exams. I actually knew about that before. I knew about it when I was in residency. So that was one of the things I worked on when I was starting my practice or setting it up, is I started that enrollment process and training process with the veteran disability exam company. It still took a little while. It took a while to get it off the ground. So I opened in August. I probably didn't really see any significant volume until November, just because it takes that long to get everything going. So, I reached out to them, and it's like, okay, we're ready to get this going, because again, I needed to generate revenue. And it's very cliche. Everybody says, word of mouth is the key to marketing. And of course, it's like, well, you can't get word of mouth until you have people. But it did pick up once I got to like 75, 100 people like their spouses. Interestingly, their spouses started to join, and then family members, coworkers, that kind of thing, that started to pick up. I do want to bring up this. This is another business concept that I think is important for people thinking about going into DPC. When I first started, in my mind, and this was naive, but in my mind, I thought that I was going to basically have, let's say 500 people, and I was going to provide them primary care services. They were going to be happy. They were just going to come to me because we were offering a better primary care service. And the reality is we're all similar. We just don't like to pay for primary care service if we're not using it, unless we've had a bad experience in the traditional system. And so going back to that urgent care thing that I brought up, is that people were willing to pay me for that visit. And, when you're making money, you can make the choice to not accept that revenue. But when you don't have revenue coming in, you have to decide, okay, am I going to compromise and see an urgent care patient and put money in my bank account, or deny it, right? And in that case, you're just going to work down your cash or spend down your cash. So you have to make that decision, not only as a physician, but also as a business owner. The other thing is, you want to look at the market that you're in and see where the other competitors are not satisfying clients. And so I opened up during COVID, and one of the things that ancient history, it feels like now, but if you were traveling international, you had to have a COVID test within a small window of time. A lot of times it was 48 hours or 72 hours. And in the traditional settings, the Walgreens, CVS's, the hospital systems, they were having so many people being tested that they were getting the results back 3, 4, 5 days. Well, basically, you couldn't travel without a test less than a certain time frame. And I found out about this randomly. I had a gentleman call me up and say he needed a test, but he needed the result in an hour, which was unusual at the time, because people just wanted a test to find out if they were sick or not. And so he came into the office, we talked about it, and come to find out, Germany had changed their policy that day, and now his test that had already been done was invalid. And so I was able to turn, just a regular antigen test. I was able to turn it around in 15, 20 minutes. I wrote up a general note giving him the results. And that got me started thinking about, okay, how can I fit the community's need? And, is this a business? Is this an idea that a business idea that I can implement and turn into a business or a line of business? And long story short, I was able to not only do the antigens in my clinic, but I also got some Abbott ID Now machines, which were PCR-based machines, which a lot of the countries required PCR only. They wouldn't accept the antigen. Not only that, I did online scheduling. So people had to make appointments. They were spaced out appropriately. So I could turn around their test, give them a report within 30 minutes. The reports looked legitimate. You'd see some other folks, they would make a photocopy of something and then check the box that said negative, and of course the airport wouldn't accept it. They would get PDF copies. And then basically I said, this is the product that I'm going to deliver. And then I delivered it. Then I end up using Calendly for all my scheduling, which is an important factor because Calendly, one of the things it does is it allows you to request Google reviews. Okay. So going back to this, I'm doing a lot of tests every week. Well, let's say 10% of them respond to the Google review. I gave them a good experience. I said I was going to do something. I did it on time and I did it, and it was a clean office and, everyone was nice. They would leave a 5-star review. Then when folks were looking for primary care doctors, they would see this doctor's office currently that has like 245 or 250 reviews at a 4.9. And it's like, okay, what's going on? Why? There's no doctor's office that has 4.9, let alone this many. But that initial COVID testing is now what's driving my primary care business growth. But the key thing there's a couple of key things there. Find out what your competitors are not providing to your patients or to the community, and ask yourself, is this something that you want to do? And can you make money at it? And then 2, if you're going to do it, do it well so that you get a positive review. And then 3, you got to figure out a system. I happen to use Calendly, but you got to figure out a system to get yourself Google reviews, because as consumers, you and I as consumers, Google reviews drive our decisions. If I go to a new town and I'm looking for a tire shop because I got a flat tire, I'm going to look at the Google reviews and see who's got, stay away from those who have bad reviews, but go towards those who have good reviews. So even making a decision, where do I get my tire fixed? That comes into play. And so it definitely comes into play when you're picking a primary care doctor.
It totally does. And that's one thing that's important to keep in mind for those people who are, planning or like currently in the opening stages of DPC, is asking, how did you find my practice? And, even to this day in a small town, I literally have people who are like, oh, I found you on Google. Like, oh, you're the doctor. Like they walk in, they know it because that my picture's on Big Trees MD's Google Business or Google My Business, whatever it's called now. But yeah, I totally agree with you. And I love that by talking about your financial runway and now talking about diversifying your income, I think that it's really smart, whether you're doing side gig, whether you're doing different services, one-off services, like you're talking about everything at the end of the day, if it's in alignment with what you want to do, and you're still able to take care of everybody that you need to take care of, including yourself and your family, and financially it's working, then, this is where if you've seen one DPC, you've seen one DPC. So I love that you've taken this diversification to your advantage and it's helped you. That's an incredible amount of Google reviews. Like that's amazing. So let me ask you there, because as you're growing your practice out, your kids are little. At the time, they were 4 and 1 when you opened. How did you balance doing all the things as, Dr. Lovelace at Derby City DPC and being present as a husband and as, just Dr. Lovelace himself and as a dad?
I mean, honestly, I probably didn't do it. I didn't do it as well as I should have. I will be honest about that. In the beginning, I was so hyper-focused on generating revenue because it was, we had a mortgage, we had utilities and daycare and all this other stuff going on, right? So we had expenses that weren't going to go away. And so it was like hyper-focused on generating revenue, buying more time to get the business off the ground, because I really did not want to go work for a hospital system. And I think about this, by this 6 months point, the DPC really wasn't growing that fast. And I had plenty of time. And so I started looking for moonlighting gigs. And so I found one that was basically with a company that offers, it's like employer-based healthcare. So they didn't bill insurance, so I didn't have to be enrolled. So it matched up well, and they needed doctors. And they had evening shifts and stuff like that. So it was really good fit. Well, it was a startup. They had plenty of work and I had plenty of free time. So I ended up signing up for like 32 to 40 hours there, right? And then I would be in my clinic for 20 to 30 hours a week, just available for my patients, answering the phone calls and trying to figure out marketing and stuff like that. So I had inadvertently scheduled myself like a resident. So I had scheduled myself 80 hours a week, but I was getting paid for those hours. Now, granted, the DPC wasn't making that much money, but I was getting paid for the veteran exams. I had a few members, I had a few urgent care visits, but then I was getting paid basically full-time pay for my moonlighting gig. And I got the health insurance and 401k, CME money. Like, it was a good deal for me. But the trade-off was I wasn't home a lot. And so, if you say, how were you as a dad? If you just looked at it from like, were you, there? No. The short answer is no, it wasn't. But the long answer was, I was making money so that we could live this lifestyle, which I've improved since then, really more in the last like 3 to 6 months, as far as being present in my children's lives. Because I worked hard for like 2.5 years, paid off debts, saved up some money. And it was like, okay, I could keep running this same pace and keep, trying to quote, make a lot of money, but is it really worth it? And, I did I got some good advice from folks who, had older kids and stuff and knew about my business. And, they're just a heads up, they're growing fast. You're not going to get this back. And, just be careful because the next thing you know, they're 15 and they don't want to see you anymore. So in the past 3 months, I've cut back my moonlighting gigs. And so instead of being scheduled 2 nights a week and a weekend day, I'm only doing PRN shifts. And so I have to do 3 shifts a month. So I went down from 12 shifts a month to 3. There's obviously a financial trade-off, but now I'm intentionally able to participate in I was able to do baseball this year and soccer and my son's doing first tee golf. And so like, I'm able to be a lot more involved in the kids' lives. It's crazy. I got to do one for my son and one for my daughter, like first grade and kindergarten. And then my daughter was preschool. I got to do go in and talk about career day as a doctor. And those kids can be intimidating. They come at you with a lot of questions but if I worked for a regular hospital network, there's no way I could take off a Wednesday at 10 o'clock in the morning and go hang out at preschool for an hour. But my daughter loved it, and it was a fun experience. And we got, hang out with her friends and stuff. And the same thing for my son, it was like 8 o'clock or 9 o'clock in the morning on a Tuesday. And it was a last minute request or 2 weeks out, something like that. And we all know, you can't just go into your regular clinic at XYZ hospital and say, oh, I need to come in 3 hours late that day. You're already booked. So it's like, even if you want to be intentionally involved in your kids' lives, you need to know these things 6 months out so you can beg to come in late for 2 hours so that you can do, something at the school. And by me cutting back on my hours and being a DPC doc, in the last 3 to 6 months, I've definitely been able to do a lot more activity with kids. So like I said, in that area, I've definitely improved from when I started.
Well, I appreciate you, sharing and being so open and honest and vulnerable about that, because I think that, when we go through these DPC journeys, there's things that we might want to change. There's things that we might want to improve on. But the fact that, like you said, you're not in a hospital setting, so you could easily say, I determine my schedule. I'm realizing that this is my priority. Now I need to make my work things align with my priorities because, these are the priorities that I'm setting first. And so I think that's so important for people to hear, especially if they're, with young kids or with older kids who still want hugs from their parents. I aspire for that when our kids are bigger, but, or the people who are planning to have families. I think that that's really important to hear because, patients come and go, but family is family. So when you, from this place of, 3 to 6 months ago, you're like, hey, I need to realign my intentional time with my kids and my family, and I need to adjust so that everything's working with my priorities. You do offer an awesome amount of services in terms of you're going to be doing FAA physicals. On your website, you have listed a medical cannabis, you have ADHD and mental health, Botox and Xeomin, as well as DOT physicals. So as you've shared, you use Calendly, and I was super impressed by that because I was trying to schedule myself into all of these appointments. And I'm like, Man, they're literally like, you can have all of these different services on the same, like Monday, Tuesday, Wednesday. So when you were trying to figure out like what will work with my plan, did you set a certain number? Like in Calendly, you can say like, I only allowed these many a day. How did you incorporate diversification with these different services for members as well as non-members into your practice while still being in alignment with where you want to put your focus and your time?
Yeah. So each one kind of came from different, like they had different, I guess, origins. So for example, the DOT, I was at a local business chamber meeting, and one of the people there was complaining that the large corporate provider of DOT exams, that his employees were there for half a day and they didn't like it. He didn't like it. It wasn't really working for his business. And he asked me, is this something that you could do? And so I wasn't planning on doing DOT exams, but I said, well, let me look into it. And basically you had to study for a week. I studied for a weekend, got the information on Thursday, took the test on a Monday, passed the test, and I was able to do it basically like within a week or so. Now, truth be told, I've only done 2, I got a third one coming up. So I really haven't even broken even on it, but it's there now, right? And the licensing is good for an extended period of time. And so now when it'll start showing up on Google, and I'll start generating some additional revenue. And basically any revenue that I generate going forward is 95% profit because I'm not spending money on marketing for it. And I've already paid for the testing and stuff. So that's where that came from. The medical cannabis, Kentucky's got an unusual situation. Basically, they wouldn't pass anything for medical cannabis. So the governor issued an executive order saying that he would pardon folks who had one of 21 conditions, and they had a note from a physician stating that they had one of those 21 conditions, and they had less than a certain amount of medical cannabis, and they had to buy it from out of state at a legal dispensary. So there was a lot of hoops to jump through to qualify for this pardon. Well, unfortunately, and this is going back to, if you look at the landscape and see what does your local medical community not provide, and what are you comfortable doing and what are you willing to do? If you find a niche, you can actually generate a business or a line of business from it. And so this medical cannabis certificate is literally a statement that states, I have met with Miss Smith. Miss Smith has Huntington's disease. And the local hospitals and physicians or local hospital networks would not allow their physicians to write that. And so they would take literally folks with terminal illness, Huntington's disease, PTSD, cancers, multiple forms of cancer, significant illnesses. And if these folks wanted to go out of state and buy some medical cannabis, the networks would prevent their physicians from writing these statements. And so I didn't do, I probably did 20, maybe 25 letters or certificates, but I offered it as a service. And so I would get records from the cancer center and say, yes, this oncologist says this person has cancer. And so they meet the qualifications, and then also make sure that they understood all the rules and stuff. So that is where that came from. And then like the other stuff, like I was kind of interested in doing some Botox. I will say this, that was one of the things where I did it prior to leaving residency. I went and got training. And then when I moved up to Louisville is when I started doing it. And it's a very challenging business to grow because your materials expire pretty quickly and it's word of mouth because it's a very competitive market to advertising. So that's another thing when you're setting up your business is you want to understand who you're competing against for advertising. So if you do want to show up on Google Ads, if you are advertising medical cannabis in a state where it's legal, it's going to be very expensive because they have unlimited money. If the same thing for Botox is going to be very expensive. In Kentucky, if you're advertising medical cannabis, there's nobody here because it's not legal. So it's cheap from a Google Ads perspective. But like it's going back to it, the Botox I do more as fun. It's not really a money generator at this point. And that's okay. That's one of the things as a business person you have to realize is that some of your ideas are not going to work. And some of them you just have to end and cut your losses. But some of them, like in my situation, the Botox, you can just dial it back. I don't spend money on advertising. But when my patients come in or neighbors or, people I meet, or if they happen to find the website, if they say, hey, can you do some Botox? Can you do some Xeomin? Sure, we can do that. And I just limit my inventory so it doesn't expire. But as a business person, you do have to realize when an idea is not working and then cut your financial losses.
And, just like you were mentioning before, like you're able to do that and then decide what you're going to do next. Like you don't have to wait for somebody to approve, like, yes, we can change this workflow, or yes, we can, reduce the number of this XYZ and then increase the number of the other XYZ. So I love that. When I looked at your website earlier, you have pricing and you have like, for your Botox, it'll say, like 10 to 25 units or whatever, and it'll have the price, and you like the price for your practice now has gone up from the $80 per member per month. But what I really liked is that, it'll on like your mental health tab, it said like, it's $99 a month for membership that includes mental health. And it's like, if they missed that, that it was $99 a month to join your practice as a member, it was like on multiple pages. So it was like wherever they landed from the Google search or whatever, they could learn about the practice, especially about the membership. Have you found it helpful to have pricing on your website? And if so, why?
I decided to put pricing on my website pretty, like you said, pretty explicitly, because as a consumer, I really get frustrated going to websites and not finding, okay, yes, I'm interested in this service, but realistically, how much is it? And so like, for me, it's a pet peeve of mine. So again, I look at it from the consumer's perspective. So I was definitely going to be listing all my prices, and I try and list everything everywhere. So yes, Google a Botox clinic and you will find half of them don't list the price. So, but they'll take your appointment. And so you just show up and then they tell you that it's $20 a unit, $10 a unit, whatever. I like to put it all straight up front. That way, when people call or when they make appointments, there's no gray area or anything like that. The $99 a month thing, like the individual, like the ADHD, the mental health, that was actually, I got that lesson from a friend who's in marketing. And he basically mentioned that because I had it in a different format. And he was like, you need to just come out and say it. And it needs to be, basically, they're going to read the first sentence. And if they're not interested, they click away. If they are interested, maybe they read a few more, but basically they're going to click away at some point. None of us read the whole pages, but that's okay. And so I just wanted to, on each page, I want to drill down and reemphasize that this is membership, that this includes full scope primary care, which includes mental health, which includes ADHD, which includes primary care, at least for my practice. And so that can be helpful for folks because there's a lot of niche providers now. So there are folks who just treat ADHD or folks who just treat mental health. And it's even like just straight up, they only prescribe Zoloft. So it's not like they're managing multiple psychiatric meds or anything like that, but that's their niche. And a lot of them are online now, and they will charge $80 or between, let's say, $80 and $150. And so what I'm trying to communicate to those patients is you're already paying blank $80 for just your Zoloft prescription. For $99, you get your Zoloft and your birth control and your ADHD meds, if that's in play, and your primary care. Like, this is actually probably going to save you money. And that's part of the message that I try and deliver to the patient.
Love it. And when you were going about, like you said, you used to have the copy different on your website. Do you manage your website or do you have someone manage it for you?
I manage my own website. I learned a lesson. So here's what happened. I was doing the COVID testing. It was booming for international travel. I had my own terrible website up that I created myself on the fly. It looked like I created it myself on the fly, but people were coming to it and it was working and the Google ads were working and I was busy. Let's say I was 70% booked. I mean, I was rocking and rolling. And I said, you know what? Maybe if I hire somebody professionally and pay a little bit more, I can scoop up some of this 70% or 30% that was left over. And, maybe it's a better business decision. So I went through the process. They were great. They were very nice. The website they created was great, but they didn't understand that I already had like a working product that was very niche and very time sensitive. And whereas they were coming at it from a thing like, we're going to build this website. And then through momentum over 6 months, you're going to start, people are going to find you. And I'm like, no, they're already finding me. I need you to make me find more people. And unfortunately, what happened is overnight, literally overnight, my traffic just bottomed out. And because it was a new site, new page and all this stuff, and Google, it likes longevity. And so it didn't see this saw it as a new page. So it was not going to, pop it up top. And then their ad cycles were also messed up as well. So I tolerated that for about 2 weeks. I mean, I could see the revenue plummeting because the bookings were plummeting. And so basically after 2 weeks, I turned it off and I said, look, they made it. The website that they created was great. It looked great. It really looked professional, but it didn't generate revenue. And that's the key. If you're going to run a business, it's got to generate revenue. So this is a tough choice when you're starting your own practice. Okay. You need to spend money to bring people into your practice. And so if you hire a web designer and they create a beautiful website and they optimize your search engine optimization and they come up with great ads and boom, that's going to cost a lot of money. Okay. Let's just call it 25,000, just pull it out of the air. Right. But you don't have any money because you don't have any patience. And the reality is, let's say again, at $100 a month, you need hundreds of people or 100 people signing up with you really quickly to generate revenue to just pay for that. And then the other part of it is they're going to maintain the website. They're going to do edits. So you're paying monthly for them to also be your vendor because they're doing a service for you, which is fair. A lot of times your margin in your revenue growth just is not there on the DPC market to justify it. How many new patients do you want to take on a day? 2, 3, maybe? How many in a week? 5, 10, maybe? You talk to folks who do 10 new patients in a week and they're just pulling their hair out and they're exhausted. Let's say it's 5. That means your revenue can grow by $500 a week at $2,000 a month. And you've socked down $25,000 to get the website off the ground and you're paying $1,000 a month for maintenance, right? You're just sinking and you're just burning up your cash. And it's frustrating because that's when you need to do the best marketing, but you don't have the money. And when you finally do have the money, you've got 200, 300, 500 patients, you don't need to spend marketing money. But that's the reality of being a DPC owner is even though it's in your gut to spend a bunch of money in the beginning and market like crazy and really go, glamour and you're just spending money you're probably not going to get a return on. Because even if 1,000 people wanted to sign up with you on day one, you couldn't even handle them. And you'd have to turn the business away, which means you turn the revenue away. And so you're not going to get that revenue. So that's a long-winded story saying I tried to do the professional marketing thing and it kind of burned me. But then also secondarily, like when you're first starting, it's really dangerous to sign up with a professional marketing crew.
Well, I think you've done a fantastic job with your website. Tell me about your logo, because I'm obsessed with your name, like Derby City Direct Primary Care. Like just it rolls off the mouth. And I get it, you're in Louisville, fine. But I think it's super awesome. And I love your logo. So tell me about your logo.
Well, my friend who designed it's going to love this. But I have a friend who's a professional designer, graphics designer, and has been doing this for many years. And so when I was getting in residency, when I was coming towards the end of it, I reached out to him and said, this is what I'm doing. This is what I'm looking for. And so he came up with some concepts. And so, Louisville is the home of the Kentucky Derby. One of the nicknames for the city is the Derby City. And there are tons of businesses. There's actually a Derby City dog pooper, pooper scooper or something like that. But there's Derby City Gaming. There's everything, right? So it does roll off the tongue and it's obvious to everyone locally that it's a local business, so you know where it's at. The other thing that I find that's funny, but I think it's fair, is that nobody can sue me for trademark. I can't sue anybody else for trademark because it's Derby City. Like literally everybody's using it like crazy. So a lot of times you come up with this unique, what you think is a unique name, and come to find out somebody in California is also using that name. And then you get into this, you potentially can get into a legal squabble. So, but he came up with it. And the thing I really liked about it was that it didn't have any medicine in it. There's only so many logos that can have a stethoscope in it or a heart in it or EKG sign in it. And he had a few of those. But it jumped out at me when I saw the horse. And I just liked the circle. And it was just a really cool. And also, it looks okay. It looks good on shirts. That was something you got to think about. One, how's it going to look on a business card? How's it going to look on your website? How's it going to look on a shirt? Because if you're going to throw it up on a shirt, it needs to look okay because you're going to wear it all the time.
I love it. Reminds me of when Dr. Erica Young in White Marsh Island, Georgia, she was talking about how like she wanted something that looked good on a sticker, and she found a sticker on someone's like Vespa or something, and it was her sticker. And so I think your logo is awesome. So good job there. So in closing, I just want to ask, are there any other financial, nuggets of gold that you have, experienced from the DPC space? And now that, it's 2023 and you've been open, well, like literally it's 3 years since you opened, because today is August 1st that we're recording. So happy anniversary. That's amazing. Yeah. Are there any other nuggets of gold that you would like the audience to know when it comes to being financially savvy and being a DPC physician?
So yes, one more key financial tidbit. I have a finance degree. I've worked in finance. I've worked on budgeting. I have an MBA. I got all this business background. And so I never claimed to be an accountant. Really didn't like accounting when I had to take the classes, but I knew enough to get around. I could, like I said, read a P&L statement, a profit and loss statement, and understand the reports. So when I opened the business, I got a regular accountant really on the cheap and really cheap. And for the first 6 months, it worked out fine because I had limited revenue and this person was able to keep up and everything was fine, right? Go into the next year, basically the second year of operations, the reports start coming in less frequently, like my monthly P&L reports. And this person doesn't live live or work in Louisville. They're in some other part of the state. And all of a sudden, I'm not even getting billed for their services. And I'm like, well, this is weird. So we get to October or November. Now I know that I'm making money because I'm able to do my own budgets. I can see, I know what my costs are and what my revenue is. So I'm comfortable with that part of it. But I'm like, okay, we got tax season's coming up and stuff, and I'm not an accountant for taxes. And so I just get ghosted. And I call the number's disconnected. And this is November, and I'm panicking because we, as a young family, we had everything up in the air. We had moved from one state to the other. We had sold a house. We had kids and retirement accounts and business and all this stuff, right? And so thankfully, I went to the DPC website and looked at the accountant recommendations, and I talked to a few of them and, explained the situation. And I got my accountant, and I don't know if we should say names, but if anybody wants to call me or email me, I'm glad to share the name. But anyway, yeah, so we had a heart-to-heart conversation. I just laid all the cards out and go, look, I've got 30 days and the year's over, and I'm flying blind here on my finances. And I don't even know if I can get the data because I don't have access to the QuickBooks that they were using. But this person is very skilled and very good at their job and has basically a straight up pricing schedule. So again, before I even talked to them, I knew how much it was going to cost because that was on their website. That goes back to my argument earlier. For me, my preference is you put your prices on your website. So when people call up, they're not thinking you're $300 a month. They're not thinking you're $25 a month. They know you are exactly X amount per month because that's what you've listed. But this person was able to basically retrieve the data from QuickBooks and then cleaned up the prior year. We did our year-end taxes and then helped me with financial planning going to the next year. Because as you become more successful, your tax brackets change. As you have kids, your tax implications change. And then they've also, as we know, Congress is always making changes to it for the business as well as the individual. And so this person, again, I thought I knew kind of what I was doing, but this person is have you thought of doing this? Have you thought about doing that? And, if you do this, you could deduct it. And I'm like, oh. And so basically, light bulb goes off and like year one, I spent a lot of money on taxes. Year two, I spent a lot less on taxes. And I'm more than paid for how much this, more expensive accountant cost me. So long-winded, what I would say is, if you're going to spend money, spend it on an accountant in the beginning, because there are things that you're going to do, whether it's depreciation, whether it's your retirement accounts, whether it's your salary that you're going to draw from your business. There are things that the accountant will know, and they can say, okay, if you do this, you can reduce your taxable income, or your income is so low this year, it doesn't make sense to buy this expensive equipment. Just save it till next year, or we can carry it over next year. That's the questions that the accountant can really make a big difference and truly save you a lot of money. The other thing I will say about my accountant that I really like is he essentially has a DPC model. It's a subscription model, not a DPC model, subscription model. So, and I have no hesitation just firing off questions to him randomly, saying, hey, if we do this, if we do that, or explain to me again. So we've converted to an S Corp, so I'm getting a salary. And I'm like, hey, by the way, I'm no longer doing this moonlighting job. Like, when do we need to readdress my salary? Like, it's from a legal and an accounting perspective. And he'll answer back, and it didn't cost me anything more. And I think what I got trapped in or convinced myself with when I first started talking to accountants, they were per hour kind of thing. So, a phone call or an email was $50 or whatever. And so me being cheap, I was never going to engage the accountant. So even if I had the question, I'd probably Google it and go with that instead of spending the $50 to talk to the accountant. And that wouldn't be good for me. And like I said, I went cheap and I got what I paid for in that circumstance. So if you're going to run a real business and you got to complicate it, this person does our home and our business because they're both connected. It's definitely worth the money. So I would highly recommend spending some money on that.
And coming from you with all of your background in finance, like that is so important for people to hear. So thank you so much, Dr. Lovelace, for sharing your story today.
Thank you. Thank you for having me.
Next week, look forward to hearing from Dr. Phil Hellman of Paradox Health DPC in Rochester Hills, Michigan. If you've enjoyed the podcast and you haven't yet done so, subscribe today and share the episode with a physician you may know who needs to hear about DPC. Leave a 5-star review on Apple Podcasts and on Spotify now as well, as it helps others to find all these DPC stories. Lastly, be sure to follow us on social media. If you're wanting to continue learning more about DPC in the meantime, check out dpcnews.com. Until next week, this is Marielle Concepcion.